Amplitude modulation. This is the mode where treatment is interchanged with pauses. The duration of pause is always 1 second, and treatment time can be changed from 1 to 5 seconds. There are some certain recommendations on when to use different proportions of signal and pause. 1:1 is the modulation which is intended for neurostimulation. It is used with all types of electrodes, but mainly with self-adhesive electrodes and conductive gloves. 2:1 is used for surface myostimulation and also in cosmetology. It can be used with all types of electrodes, but mainly with Pons electrode and conductive gloves. 3:1 is the universal mode. This combination of signal and pause is the most comfortable for majority of patients and can be used in any situation with any type of electrode. 4:1 sports mode, training of strength and speed. Use self-adhesive electrodes or conductive gloves. 5:1 is also a sports mode, training of strength and stamina. Use self-adhesive electrodes or conductive gloves. B or B sting. This mode also relates to amplitude modulation, although it stands apart. After the electrode is applied to the skin, the device activates with maximum energy for a short time and then turns off. This mode is used for competitive analgesia and uses the built-in electrode only. By using it, you can breach the central nervous system's block and relieve patients' painful sensations.